for joining us today on the Pink Ribbon Roller Coaster. We have a friend with us, Maggie Bush. She is the director for grassroots engagement with the National Breast Cancer Coalition. And she is a great friend of mine, a great friend of Project31, and of the breast cancer community. So, Maggie, thank you so much for joining us today.
Thank you, Jennifer. Nice to see you.
You're welcome. If you don't mind just sharing with us a little bit about what got you interested in breast cancer advocacy.
Sure. Thank you so much for having me. As you said, I'm a friend to Project31. I had the chance to be with you all in Oklahoma City earlier this year and meet your incredible advocates. And I just so love everything that you're doing to support the breast cancer community locally and even in our work here in Washington, D.C., where NBCC is located. What got me interested in breast cancer advocacy, I think like many people, it was a very close personal connection with the disease. In my case, I had a colleague in my late 20s who was my age, much at the same stage of life, thinking about, reaching new heights in her career, starting a family, getting married, just around the same time I was also doing all those things, who found she had breast cancer. And that, again, in our 20s, and that hit me like a lightning bolt. And then a few years later, there was a mom in my neighborhood named Kristen. Our daughters were the exact same age. We had little kids. She was dying of metastatic breast cancer. And in her very last weeks of life, she was selling her daughter's old toys so that her husband would probably be able to afford to keep their house after she was gone. She knew she would be leaving them, and that's what she was forced to spend her time doing because of the financial burden that the disease brought upon their young family. I think seeing those two young women just in my immediate orbit have that stop their lives in their tracks at the same stage of life that I myself was in, just showed what I think we all know, which is that we are all so directly going to be impacted by this disease one way or another. And so when the opportunity came up to work with NBCC and I got to meet some of the incredible folks who power this organization, I knew that it was a chance that I did not want to miss out on. Generally, I've worked in women's advocacy organizations throughout my career. I have found that it is just where I belong. Women run our communities, in whatever we mean by that. Women are the ones making things happen. Now, as a mom of a daughter, I understand that even more so. Women are the ones to step up and get things done, and to take care of our neighbors, and to demand change when they need to see it. And so I have been so honored to be part of the NBCC team, where I work alongside several survivors and just people at the top of their game working to end this disease. And also to meet our hundreds of advocates around the country, including the folks right there that you work with at P31, who are demanding change and demanding that we find an end for this disease.
That's great. Man, you got me in the feels. I'm like, oh, that story. It just hits home. It really does with everything that we do and we fight for. That hits home. So tell me a little bit about what does the Breast Cancer Coalition do?
Sure. So we were founded in the early 90s. I think there was a recognition among, lots of smaller breast cancer organizations around the country at that time that a bigger voice was needed at the national stage to demand change on breast cancer. In particular, at that time, it was around funding dedicated breast cancer research and finding out why women were getting this disease, and men, and why it was in the case of folks with metastatic disease, why it was killing them. So today we do a lot of that. I'll talk a little bit about some of the specific ways that we do our work, but we convene and always have convened hundreds of voices from around the country, different organizations similar to yours, to bring the voice of breast cancer advocates to have a seat at the table where decisions are being made that impact all of us. So we convene hundreds of meetings with lawmakers every single year to talk about the policies that affect people with breast cancer, to demand better when it's needed. And we also convene hundreds of opportunities for breast cancer advocates to get involved in science advocacy as well. So whether that's sitting on a grant panel, weighing in on a clinical trial, making sure they have an opportunity to participate in a clinical trial, providing the training for advocates on the basics of science so that they'll have an opportunity to provide educated input into how science decisions are being made, and hopefully in the goal of ending breast cancer. We also work directly with the science community as well. So we have a project called the Artemis Project that convenes scientists at the top of their game from around the country throughout the year, and they are tasked with leaving at home whatever it is they are specifically focused on working on in their institutions, and coming together and thinking of new ways to answer the key questions of what's causing breast cancer and what's causing people to die from breast cancer, and what are the big things that we need to be thinking about in a scientific way to work toward an end. So the Artemis Project is sort of a scientist level program as well that NBCC founded and continues to convene. So we're just proud to be that voice. Everything we do is to make sure that breast cancer advocates, whatever that means for each person, have a seat at the table where decisions are being made that impact them. And everything we do is driven with that goal in mind.
That's amazing. I think I learn new things that you guys are doing all the time, and I'm just constantly amazed. I think many survivors and thrivers would honestly be surprised and amazed at how much the major accomplishments that NBCC has played in breast cancer. Do you mind sharing maybe a few of the top accomplishments?
Sure. So like I said, when NBCC was founded, it was really upon a recognition that research needed to be done on this disease, dedicated research to really look into, again, what was causing the disease and how we could stop women and men from dying from it. And so a number of NBCC partner organizations came together for some major campaigns in those early days. I'm talking about the early 90s. They marched in the streets. They demanded federal attention be put on this disease. They didn't take no for an answer. And ultimately, long story short, I welcome folks to go to our website and read a little bit about this. It's stopbreastcancer.org. Ultimately, they found a home in the Department of Defense where members of Congress on a bipartisan basis were willing to fund dedicated breast cancer research programs. And so that became the DoD Breast Cancer Research Program. It's now been funded every single year since fiscal year 1992. We have to advocate for that program every single year. The dollars that come from the federal government for that program have helped support hundreds of research programs, thousands probably, in research institutions all across the country. It's been the driving program behind finding some major innovations in breast cancer treatment that I think folks will recognize. So the drug Herceptin came about because of this DoD breast cancer research funding, because it allowed scientists to figure out what that drug was going to do. CDK inhibitors as well have come out of that program. We know so many people, so many advocates in our community who have been part of advocating for this program, and now find themselves on these very drugs in many cases, which are extending their quality of life, keeping them alive longer, or allowing them to live better lives. So it's pretty incredible to see. But those are just some of the innovative things that have come out of that program. One other thing that people might be familiar with is the breast and cervical treatment program. So this program, again, came about up through our grassroots. Actually, there was a program for screening women, low-income women, for breast and cervical cancer, but there was no treatment process. So women were being screened because of the federal government program, finding out they had cancer, and then in many cases did not have the means or health insurance access to pay for the treatment that they then needed. Um, Grassroots members of the NBCC said, this is a huge problem. We need to fill this gap. And after a tough bipartisan advocacy effort, the breast and cervical treatment program was passed. And since 2000, every single state has adopted and implemented that program, and thousands of women have been treated for their cancers through that program, some of whom still advocate with us today. Now that program is threatened because of the cuts to Medicaid that we've seen, because of the Big Beautiful Bill Act that Congress passed earlier this summer. We know that that program will be threatened in many states. So many of our advocates are keeping a close eye on what's happening in their state so that we can speak out and say, this program needs to stay protected. We need to be treating women for the cancer when we're finding it.
I agree. That's amazing. I mean, so many of us are touched just because of NBCC and everything that they have done. And yeah, I'm constantly amazed. I think for myself, I didn't know much about advocacy and didn't know about NBCC and everything that they have done. And a lot of us, as survivors, as thrivers, we want to have meaning given to our lives after we're diagnosed with breast cancer. How can we give back? How can we help serve others? So I think, this is a wonderful service that NBCC does, and I just love it. What can you tell us about the two top priorities for NBCC right now?
So right now, as I mentioned, the DoD Breast Cancer Research Program is absolutely just a pivotal program of prime importance to us. We have to advocate every single year for federal funding. Now more than ever, that's important given the overall environment right now of threats to science research, threats to federal funding for medical research programs. So, within that context, we are always prioritizing that. We're asking bipartisan members of Congress to support that program. We contact hundreds of congressional offices every year to ask for their support for that program. And then we have to be constantly vigilant for any threats that may arise to that program because it is so important, because it has led to so many innovations. We cannot be in a situation where we undo decades of forward progress, towards again, and finding an end to this disease. So the DoD Breast Cancer Research Program remains a top priority. The other main priority that you and your team have had a lot of influence over is trying to get the Metastatic Breast Cancer Access to Care Act passed. Folks who are living with metastatic disease, and I know you have many in your Project 31 community, in many cases, even if they qualify for care through the Social Security Disability Insurance Program, they qualify for care through Medicare if they can no longer work. They must wait right now. The waiting period is about 2.5 years to access their care. Now, many of you know that the average lifespan for somebody once they've been diagnosed with metastatic disease is only 3 years. So we know there are thousands of women waiting just to get the health care that they already qualify for and that they deserve. And we have to put an end to that. So our legislation would close that loophole, provide the immediate care that people need, so that they can live their lives, so that they can afford to pay their bills and spend time with their families, even in the face of a terrible, terrifying diagnosis. You all have been so important to this effort in Oklahoma. You've brought on, to these conversations with lawmakers, women who are directly impacted by these waiting periods, told their stories, had them join these meetings, and it makes a huge difference for our lawmakers to hear directly from people with the lived experience of what this means if you have to wait for your basic health care, what that means for them, for their families, for their community, for their local economy. The impact is enormous. And when lawmakers and their staff hear these personal stories, they really do pay attention. This legislation had more support in Congress in terms of legislators co-sponsoring it last year than 99% of legislation in Congress.
Wow.
Right now, this year, we have 145 bipartisan co-sponsors for the legislation, including a few folks from Oklahoma that you all have been instrumental in helping to secure. And we're demanding that Congress, get this passed. We have to get this done.
Yeah.
And so that's a major piece that lots of our advocates work on year in and year out. And then finally, I would say again, I've mentioned the kind of current context. We fought hard against the cuts to Medicaid that were passed in the Big Beautiful Bill Act earlier this summer. Right now, folks following the news might know that even right now, in the next few days, the government is facing a funding shutdown. The key negotiating piece at the center of that debate is whether or not Affordable Care Act or Obamacare plans will remain affordable for millions of Americans. So we right now are saying Congress needs to extend the affordability measures. It's a tax credit that they first put in place during COVID. It has made healthcare more affordable for millions and millions of people. And we need to figure out a way to maintain those protections for people, because if not, people are going to see their premiums skyrocket starting in the next couple of months. And people are going to ultimately be unable to afford insurance care. And we know that will impact the breast cancer community. It will hit them hard. So I named 3 priorities, but that's our other main focus right now. And that's something that's happening right now, this weekend as Congress is debating what they're going to do. So, we ask anyone who's listening and wants to get involved, you can go to our website, you can take action on, any of these issues by writing a letter to your member of Congress, and telling them what matters to you as a breast cancer advocate.
It's so important, especially right now with the economy, how it is.
Yeah.
So I know you've talked about, yes, we have advocates now in Oklahoma. Do you have advocates in every state, or how does that work?
Yep. So we have hundreds of organizations and thousands of individuals who interact with us in different ways. Some folks are really interested in doing the the types of policy work that I've been talking about, meeting with their members of Congress, sharing their personal stories. Some are really interested in the science advocacy aspect of our work, and many are interested in both. So we have advocates in all 50 states that we work with on these things. We have strong active networks in probably about 45 states, where we have teams of people who are working every day to advance these priorities. And we're always interested in encouraging more advocates to get involved in whatever way makes sense for them.
Wow, that's great.
And I just have to say, so with your team and with other teams around the country of advocates, in many cases, we're talking about people who are in active treatment, who are going through personally, in some cases, just a nightmare. In many cases, they know their life is coming to an end sooner rather than later. And yet they find the energy and the commitment and the dedication to take part in this work, not because they think it will benefit them, but because they know it will benefit the people who come after them. And that has been just the most incredible part of doing this job. That was the piece personally that I was least, I think, prepared for, to just see that and feel so honored that these advocates could find the strength and the commitment to do that, even in their most difficult, moments of life. And that shines through, and that's why they make a difference, because they're willing to do that.
Yeah, you bring up that point, and that's huge. I mean, and they're leaving a lasting legacy
Mm-hmm.
for other survivors and thrivers out there as well. So, yeah.
Absolutely. Absolutely.
So if somebody wanted, I know you mentioned your website,
Yeah.
but if people out there want to get involved, want to do more with advocacy and MBCC, how can they do that?
Yeah. So I encourage folks to go to stopbreastcancer.org. If you click on where it says take action, you can find immediate opportunities to take action on some of the policy related things that I've talked about. We also have in-person events throughout the year that provide a range of skills training for breast cancer advocates. So we have a program called Project Lead that takes place every summer. It's a week-long intensive science training program for breast cancer advocates who are interested, again, in having that grounding in the science that is driving what the research community is doing, what the medical community is doing, so that when they do have a seat at the table, even whether it's for their own care, but even more so when it's that they're getting involved in a research program in some way, they can bring an informed advocate voice. So that program is really spectacular. I went last year as a student, and I learned so much. And I really, really encourage folks to check out that program. It's called Project Lead if you're interested in the science training aspect of things. We also have a DC-based event every spring. This coming in 2026, it'll be the last weekend of April. And we have our leadership summit. We bring the leading speakers on all aspects of breast cancer advocacy to come speak to our hundreds of attendees. And then we all go up to Capitol Hill and take to the streets and take to the halls of Congress and, have hundreds of meetings with lawmakers. It's an incredible day. And I, would love to see some of you there.
That's amazing. Wow. Well, I'm blown away. I appreciate everything that you do. And I mean, from being a part of this, I would say I've learned so much, and it has meant so much to me to see the effort and everybody come together fighting for the common cause of breast cancer. And it's special to my heart. And I thank you and everybody involved in what you do. So,
yeah, thank you, Jennifer. Thank you.
Thank you. And I appreciate you joining us today on Pink Ribbon Roller Coaster. And have a wonderful day, everybody. Join us again.
Thanks, everyone.